Hello, my dear pharmacy students. The video which I am going to make today, that is, I am making in English version only because this video is mainly for the fourth year students, and I think that it is a very prime necessary to know this particular language English for fourth year students, as they have to go beyond their state boundary. They may have to go beyond their state boundary, and they may go in such regions where there will be no other languages than English to communicate other people. So a little bit habit of English is very much important. Yet if you want to understand the things in Bengali also, then you can comment in the comment box. But right now the video which I am going to make, that is in English version, and the topic which I am going to tell you about today, that is the documentation system, basics of the documentation system in industry. See, there are lots of documents and it is not so easy to cover all those aspects in a brief video. But what is document, what is record, the basic ideas which is not written in the books, especially in the B.Pharm course or diploma course, and which you should know, that outline idea I am giving. So first things, you see, there are many documents, but what kind of documents are that and why documents are required, you have to know that. So first thing, the practice which is followed in industry, that is called GMP. Okay, this term you will be very much acquainted with whenever you will be there in one industry, and the full form of GMP is good manufacturing practice. So what is a practice? Practice is established by only written guidelines and procedures. Means there are few procedures or guidelines which are already written, and that written guidelines you have to abide by. Like if one recipe is given by a very good chef, then we used to write that down, and we used to try to make our food, what we are going to make or what we are cooking, that should be according to the chef's special, like that. Now like that only, whatever medicines we are going to manufacture, we are going to produce to meet its intended result, that it can affect in anyone's body or in a pharmacological system, and there should not be any variability from dose to dose. So it is very much important to control the process by documents, written documents, approved documents. So good manufacturing practice is nothing but to follow the written documents and to prepare records from that. Now what is document, what is record, that I am going to discuss with you. Now see, the time when, means the full term you just see practice, and that is good practice. And how the good practice will be established? When there are some established approved documents, according to the document we are performing a task, and whatever the task we are performing, that one we are writing down in the record with proper date, time, and the person whoever doing the activity is signing. So there are a few aspects of documentation, that is called ALCOA. I will tell regarding ALCOA in a later video. The full form right now just I am saying you. ALCOA means a document should have, or a record should have, the following characteristics. What are the characteristics? Attributable. Who have done the or executed the document, that document should be attributable. So everybody have to sign in the record. Actually record is not a document, but if you think as a means as a whole aspect, it is also a document. But record is a generated copy from an approved document. Now ALCOA means attributable. Whoever preparing the record or whoever made the document should have signed with date when he had made it. And in the record there should be time also. If there is any execution of any activity, then perfect time also have to mention. Now legible means it should not be like that anybody cannot read whatever is written there, so it should be legible. Now contemporaneous, C is a long word, and the meaning is according to the chronological manner. Suppose there is an entry which you had to made at 10:10, and after 5 minutes or after 10 minutes another entry you had to made, but what you did 2 minutes before. You cannot do that in industry. You have to do after 5 minutes, means you have to do at the 5 minute plus minus 1 minute. If it is there, means it will be written in the document, and if it is not written, then definitely at the 5 minute only you have to write the value. So it should be contemporaneous, means one time after another. Now original, the document should be original. No auditor will give you the chance to show them any Xerox copy of the document. Then it will be a very big violence of the documentation procedure of your company, and your company may get a good a very bad point from the auditor. With respect to auditor is a good point. Now the next, so ALCOA means attributable, legible, contemporaneous, original, and the last one and very important, accurate. Accuracy in the document is very, very important. So these are the 5 points which all the records and documents should have. Now what is document? See, the general documents or GMP document is that which is bearing one authorized format, or means general documents. I am not telling about the record. First I am telling about the documents. There are 3 levels of document: level 1, level 2, level 3. Level 1 documents and level 2 documents and level 3 documents later I am saying. First I am saying that what is a document? A document is a authorized copy where it is written how something have to execute, or any principle, like quality manual. Every company have one quality manual where it is written that what should be the quality procedure of that company. So that is one instruction, that is one oath type. Like our constitution have preamble, like that one company have the quality policy. Okay, so quality manual, quality policy, these are level 1 documents. Like that site master file. Site master file is a document where everything of the site, means how much acre area it is acquiring, where all the plants, means segments of the buildings are situated, and all other things are written in that particular site master file. That is like we used to say Janam Kundali in our Indian tradition. Like that, a company's Janam Kundali is written in the site master file. So these are the level 1 document. Now level 2 documents, which are very, very important and active documents, those are like SOPs, means standard operating procedure, how you have to execute one activity, that is written in the SOP, and you have to follow the SOP. If you violate the SOP, then it may give one critical point to your company, or it may hamper the procedure whatever is done. So SOPs are written, SOPs are prepared, in the authorized persons only can prepare that according to the guidelines given by the marketing authority and international guidelines. Whatever guideline is there, according to that the SOP is prepared, and there is definitely one rationality behind the SOP preparation, and only those people who are authorized for the SOP preparation they can prepare. After preparation, that should be approved, and definitely that should be finally approved by the quality body, and after that only it can be executed or it can be implemented. After implementation of the SOP, nobody can write on that, nobody can hamper whatever written in that, and nobody can violate it, but it can be revised. There is definitely a scheduled revision of the SOP. If there is any requirement in between, then giving a particular justification, anybody can revise the SOP. The persons, not anybody, the persons who are authorized for the change or modification of the SOP, and that also have to give one rationality behind that, that we are going to change one SOP means simply I changed, it is not possible. Before that, one change control also have to rise. Change control is a procedure, change control have to rise, and after the change control, the change control will be given that all the details that this particular point of the SOP is not according to this guideline, or this guideline has been changed, so we want to change the SOP, or this particular point if we change means the procedure will be simplified. So those all descriptions will be there in the change control, and the change control also have to be approved by the approval authority, then only the SOP can be changed. So it is not so easy to change any SOP, because if it is so much easy to change the SOP, anybody, suppose one employee was there before who thought that this SOP should be in this particular structure, suddenly he resigned and came another new guy, then he thought that no, I should make some changes in that SOP, then he again will change that particular thing. So this much changes will bother the auditors, and also the procedure will be hampered, and there may be no rationality behind that change. So it is not so easy to change the SOP. Everything whatever is done in the premises, inside the premises of a factory, is according to SOP. So standard operating procedure, now you understood. Now MFR, master formula record. What is master formula record? What is formula? You are understanding from the term formula itself, that formula means there is a batch of one medicine, and to prepare that medicine, how much amount of all the ingredients are required, and what are the procedures, how much time that procedure to be followed, and all the hierarchical or step by step process is written in that master formula record, and that is also after the validation of the batch. I will discuss regarding the validation, what is validation of one particular process validation, another video I will make. In that particular video I will tell what is validation. So simply validation means, just I am giving one brief idea, validation means until and unless you are ensured that multiple batches of one particular batch is of one particular product is giving same result, batch to batch, at least 3 batches are giving the same result, you cannot establish one procedure, and you cannot prepare MFR, master formula record. When the 3 batches of one new particular batch, means a new particular product, are giving same result, the MFR cannot be prepared. So that is determined by the validation or process validation. Then after process validation, the MFR is prepared, master formula record, and according to the master formula record, other records are prepared. What are the records? BMR, BPR, etc., etc., and in QC they are STPs. That is another validation, that is analytical method validation. Whenever one new batch used to come to any industry, then definitely analytical procedures to analysis for that particular product or for that particular molecule or for that particular finished product is also established, and the packaging materials also established by the analytical development team, and that analytical development team used to validate the analytical procedure also. So from that analytical procedure, standard testing procedure is prepared, and whenever one QC person is going to do any test for that molecule or for that finished product or for the packaging material for that batch, then they have to follow the standard testing procedure. Okay, now general testing procedure also, GTP also is there. So GTP, STP, these are prepared according to the previous approved document, that analytical method validation record, and BMR BPRs are prepared from the master formula record. So this kind of documents means SOP, master formula record, MFR, yes, master formula record, that is also one document, whatever it is told record, but it is a document which cannot be changed. So these are all secondary level or second level of documents. Now the third level of documents are forms and formats. There are so many forms and formats which you have to follow, which is written in the SOP. Those are third level of documentation. That is why it is third level of documentation, because that is dependent on the another document. Means one particular procedure is there, in that procedure you have to follow some hierarchical process or some checklist, then that form is there in the SOP. That form you have to take whenever you are going for that execution, and you have to tick mark in the checklist or like that. So that is tertiary type of documents or third level of documents. Now what is the difference between document and record? See, record, first I am saying about the document. Document is always approved copy which cannot be hampered before its revision, but it can be changed according to the risk assessment, change control, etc. But a record is proof of action which is done as per the document. So we can never revise or do any change in the record. It is a handwritten thing. Why? Suppose there is an expired medicine complaint, or some deterioration of the medicine happened within the expiry period, and one market complaint reached to the company from the marketing aspect or marketing quality manager to the quality manager of the company. Now the BMR BPR is again came into the light to analyze whether there was any problem in that particular procedure or not. So if there is a chance of any changing in that particular thing, then any person can manipulate it. So record is not such a thing which can be changed once it is prepared. So that is the basic difference between document and record. Document can be changed giving proper justification by the approval authority, but a record can never be changed, can never be hampered, can never be tampered. Today the video I am finishing right here, and please comment, like and subscribe if you feel these videos are becoming very much beneficial to you, and it will be one appreciation from your side to myself, and I will attribute all the things which I have gathered knowledge, or all the knowledges I will give to you, and you will be enriched by my experiences, and you will perform well in one industry and in the pharma field. Thank you. Subhratri.